Today I'm going to talk about my total thyroidectomy story, how I found out that I had issues, my surgery, post-surgery and recovery. If you've watched my previous videos, you've noticed that I have a very beautiful scar on my neck. And you've also noticed that I'm always trying to regulate my voice in terms of how I'm speaking, and I'm always looking for words. So, karibu, if it's your first time, please like, subscribe, and also share the video. Today I have a tablet to just make sure that I have my thoughts in order in terms of remembering, because I can't remember everything. I'm experiencing brain fog. Now, how did I find out? So early this year, which is the year 2020, when the pandemic hit the whole world, in Kenya we actually found that in March, but in February my husband and I discovered that we were pregnant. We were overjoyed, and like any other couple, we decided to go see a gyna. So we went for our first visit, and that was in February, and we were given an appointment for April, where we were supposed to do a scan to just check the baby's development. So in April, we went to see our gyna, and when he was conducting an ultrasound, something didn't seem right. And he was so concerned, he told me not to just, there was no need for any alarm, but he wanted to conduct a few blood tests. I was sent for blood tests to just confirm the pregnancy hormone level, and this was supposed to be done 3 days apart to see whether the hormone levels were increasing, for him to confirm that the baby was okay. So I did that the first day, and on the third day I also did it, and the results were emailed to me, and he called us in. We went back to the gynecologist, and when we were there, he confirmed what he thought, which was forced abortion or forced miscarriage, because I had started bleeding, and he wanted to find out what was happening, because I'd had 2 healthy pregnancies before, and I was experiencing a lot of tiredness. I was always moody. I didn't know what was going on. So on this particular day when we had gone to see the gyna, he was seated next to me, and I was seated facing my husband. And as he was talking to me, he noticed there was a growth, there was a swelling on my neck. And he asked me to swallow. And when I swallowed, the lump was moving up and down. So he asked me whether I've noticed that I had a lump, and I told him I'm not sure what he's talking about. We were given a mirror, and I confirmed I had a lump. So he quickly recommended me to go see an endocrinologist, one of the best. So I booked an appointment, and we went to see her, called Dr. Eva. So when we went to see Dr. Eva, she was very kind. We did all the tests in terms of my blood pressure, and she asked me what I was experiencing. I told her I've been having minor headaches. I was always tired, and she also sent me for more tests. So I was supposed to do a blood test to confirm my thyroid functions were okay. I was also supposed to do a test to confirm an ultrasound around my neck to confirm whether I had a growth. And then lastly, I was also supposed to do, it's called a biopsy, to check whether the growth I have in my neck was cancerous. So I did all these tests, and my thyroid functions were okay. That was ruled out. Then the ultrasound confirmed that I had what was called a multinodular goiter, meaning there were many, and it was swelling around my thyroid. And the biopsy confirmed that it was not cancerous. So I went back to my doctor, Dr. Eva, and she confirmed that I'm okay. I would actually live with the condition. Goiter is not so alarming. She gave me painkillers, and also put on vitamin D3 for my energy levels. So I was told to come back a year after to confirm whether the growth has become big and whether it's cancerous. So we bid her goodbye, we went home. This was in April, still in April. So come August, I started doing exercise, but I was extremely tired. I was always tired. And on this particular Friday, when I was after exercising, I could not even breathe. It was so hard to breathe. I could not swallow. I had sharp pains. My head was aching, and I was extremely anxious, or should I say moody. There was something that was just off. So I called the hospital and I was told to go in and to see again the endocrinologist, and she then again sent me for an ultrasound. And when I went for the ultrasound, they confirmed that my goiter, the multinodular goiter, had increased in size. In terms of centimeters, it had grown 4 centimeters larger. And I'll just be sharing photos for you to see the difference, like how it had grown. So she was so concerned, and she told me since it was a problem with my breathing and my swallowing, I was still put on painkillers, and she referred me to a surgeon. She told me, I'm sending you to a surgeon. The surgeon will explain what will take place, and if you are ready to have a surgery, then you'll go ahead. So we went to see one of the top surgeons, that was Dr. John Kariuki. We went to see Dr. John, and when we went to see the surgeon, he was so good in terms of explaining what exactly the goiter is, where it lay, because I gave him all my reports. The doctor sent him all my reports. So he took me through the thyroid functions, and he told me my thyroid function is okay, but however, since it's obstructing my breathing, my swallowing, and also the fact that I was always tired, then he would have to perform a surgery. Because the first option was a surgery because of the beauty factor. So when you look at me, my neck was swollen. When I speak to someone, you'd see the lump moving up and down, but I didn't have a problem with that because I always put on a scarf. So anyway, so he asked me if I was comfortable I should go in for surgery on Monday, which I agreed. And we scheduled surgery for September 7th, which was on a Monday. So 5th, I went to hospital because I had to do a COVID test to confirm that everything was okay. However, there were a few, should I say, things that would go wrong. So he mentioned that he's performed over 700 surgeries. However, there was a low possibility that he would end up touching my parathyroid, which are in charge of basically calcium and potassium, and this would end up affecting me. Also, post-surgery things that I needed to be aware of was I would end up taking medication for the rest of my life, because in case he entered and he did not do a partial thyroidectomy, because the nodules had spread all over, he'd have to take out everything. So of course we came back home, I prayed, I put everything in God's hand, and we went. So I was admitted on a Sunday, all the tests were performed, and on Monday, surgery. So surgery took 40 minutes. I was in at 9, and by 10, I remember I woke up from surgery, I literally could not breathe. And I was coughing, I did not have a voice, and I could hear my surgeon saying, "Stop it, I told you not to use your voice, stop it, you lose your voice. Don't use your voice." And I tried clearing my throat, I was kept on, I was in so much, it was so uncomfortable for me. Remember they had stuck in pipes for what they call, I can't pronounce that word, but yes, they'd done that for me to go to sleep. And so the process of taking out the pipe had affected my vocal cords. So, and there's a video that we'll just share for you to see how I did not have a voice, and I had staples around my neck, and that connected a drain here, a pipe to just drain the blood from the surgery area. Anyway, so I came out, I did not have a voice, so I was advised not to have anyone in hospital because I'd use my voice. And the surgeon said that the problem with women is that we talk too much, so the healing and recovering our voice takes a long time. So I was in hospital Monday, Tuesday, Wednesday I was out. But I remember even when I was in hospital, movement was a bit, I was okay. When I woke up, after lying down, I was advised to sleep. I slept for 2 hours, I was really exhausted. Woke up, I could not use the toilet because I kept on walking. I had a bag that was draining the blood, so I kept on walking with it. So when showering was a problem, using the toilet was a problem, I just wanted to lie and do nothing. So Wednesday I came out of hospital, coming back home, my husband was extremely supportive. He did everything. I have to mention that my mom and my husband were the biggest support system that I had at this point, in terms of prayer, in terms of visiting me, in terms of just walking with me. When I came home, of course, I'm a person who likes doing everything. I didn't want to sleep, but I kept on, he kept on telling me, you need to lie down. So that particular Wednesday I was okay, Thursday I was okay. Friday, I woke up, I could not move my fingers. My fingers were numb. And I remember I woke up, I turned and I wanted to touch his hair and to just confirm that my hands could not move, and I literally could not move my fingers. I had to think of the process of moving my fingers. And I called him and I told him about it, and he just told me, start moving, exercising your fingers, nothing is wrong. I tried going to the washrooms. When I was in the toilet, half of my body went numb and I was really scared. So I went into Google, of course we always have to Google, and I checked and I saw it could be a calcium problem. So what I did, I immediately called my surgeon and I told him what I was going through, and they told me to leave the house immediately and go to hospital for an IV calcium dose. So we went to hospital, they did some tests and they confirmed my calcium was extremely low, because what had happened was I tried eating and I had muscle spasm. So the whole of my jaws were feeling pain anytime I started chewing. My heart was beating so fast, I had headache from here till where, and then I could not move. And then I had a tingling feeling, pins and needles. It was so irritating. And then I kept on feeling hot and cold. My feet would become so hot. So I went to hospital, I was put through an IV, calcium IV, and I was given vitamin D3 for still my energy because I was also exhausted. Came back home, and my voice was still not back until 4 weeks later is when my voice started coming back, but I still experienced tiredness of my voice, and then I started experiencing brain fogs. So I would walk into a room, but I cannot remember what I am supposed to be doing in that room. Up until now, that still happens to me. I can be talking to someone, but I can't remember. My words just disappear. I also have, there's a time I was driving to hospital, and instead of going to the hospital I went to a different hospital, parked the car, and then when I was walking out I thought, okay, why am I here? So I always have to ask myself, why am I here? What am I doing? What do I need? And most of the time I write things down so that I don't forget. So my post-surgery has been that. I have a lot of that. And I was put on medication, of course. So I'm taking this. I don't know whether you can see, but this is L-tropin 100 mcg. So I take them, there are 100 tablets. So I go for a refill. I will be going for a refill after 3 months, and a small tablet. So what I noticed about the tablets is I have to consistently take them every day at the same time, or else I get moody and I just go into, I don't even want to say it's depression. So what the mechanics I've put in my life is that every morning at 5 a.m. I take a pill. I wake up, I take a pill. When I'm feeling like I'm energetic, I'll wake up, brush my teeth, take a pill, do devotion, exercise, and then prepare my kids to go to school. But on days that I don't have energy, I'll just wake up, take the pill, and go back to sleep. Days when I'm very exhausted and I take the pill at 7 or at 8, my day is just confused. I notice that on that particular day I will become moody. I will not like everyone. On that particular day everything will just be messed up. So it helps to take your medicine on consistently at the same time every day. There is that, and then I've also had to change my diet slightly, because I used to do a lot of fries, chips. I used to do a lot of fatty food, but now I'm very conscious because I noticed my diet also affects my moods. So I'm watching my diet, exercise not really on and off, but I'll be sharing a different video of my regime and how I just conduct myself in general. So that has been my thyroid journey. And for those of you who are waiting to go for surgery, or you just left surgery, or you're thinking about it, if I had an option, I would definitely not have had the surgery, because it has really changed my life in terms of the things that I can do. But above and beyond that, if you have to take it, just know that the recovery is, because it's been 12 weeks for me. I'm not yet there. I'm getting there. I have a good support system, and above all, I know that God has just enabled me to be able to share my story. And now that I have my voice, 80% back, or should I say 90% back. I've decided to use it to just glorify his name. So in case you have any questions, you can comment. I will be sharing my email address if you need to just get in touch. One of the other things that I've done is joined a support group on Facebook, Life After Thyroidectomy. That has really helped because the questions people post, I can relate. I did not know that brain fog was a normal thing post thyroidectomy, but most of the people confirm that they're going through that. Loss of your voice, being moody, weight gain, weight loss. So all these things. So join a support group, ask as many questions, do your research, get in touch with your doctor if you have to change your medication, and of course having the different tests. Because every 3 months now I have to check my total thyroid function and my calcium. And of course when my calcium is low or I end up experiencing tingling or numbness, I have tabs. These are just calcium tabs that I take that have vitamin C that I take whenever I experience that. So I hope I've encouraged someone. I hope you have a little bit of, should I say, awareness in terms of what it is. But yeah, so until we see each other again, please like, subscribe, and also share. Until we see each other again, bye.